Hello everyone, today we'll be discussing dehydration. So what do we mean when we say dehydration, or when does it occur? So dehydration basically occurs when more water and fluids leave the body than they enter, okay? So basically input of fluids and output of fluids is not the same, okay? Output is more than input of fluids. So basically for all children with diarrhea, their hydration status should be classified. The degree of dehydration is graded according to symptoms and signs that reflect the amount of fluid lost. They include no dehydration, which is less than 5% loss of body weight, some dehydration, which is usually 5 to 10% loss of body weight, and severe dehydration, which is usually greater than 10% loss of body weight. So once we classify dehydration into no dehydration, some dehydration, and severe dehydration, the classification, it makes management of acute diarrhea easy. So signs of dehydration include sunken anterior fontanelle, sunken eyes, lack of tears when crying. Then they are thirsty, so they want to drink a lot of water, but they may not vomit. So that is excessive thirst, basically. Decreased urine output. So basically, how do you know decreased urine output in infants and babies? This will be indicated by no wet diapers in a 6 to 8 hour period, or diapers with a little dark yellow urine. In toddlers and older children, very little dark yellow urine is a sign of decreased urine output. Then you may also take note of rapid breathing, increased heart rate, restlessness and/or irritability, lethargy, weakness. Poor skin turgor, that is basically pitching a fold of skin at the abdomen, results in it returning slowly to normal. So no dehydration, basically there are not enough signs to classify it as some or severe dehydration. So under no dehydration, child is well alert, eyes are normal, they are not sunken, tears are present when crying, mouth and tongue are moist. However, in some infants and children, the eyes normally appear somewhat sunken. So it is helpful to ask the mother if the child's eyes are normal or more sunken than usual. So you always have to ask on this one, because others, they may just have sunken eyes and you may take it as a sign of dehydration, okay? Then the child drinks normally and is not thirsty. Skin pinch goes back slowly. And for treatment, you use plan A, okay? So basically under management for no dehydration, the three essential elements in the management of all children with diarrhea are rehydration therapy, which is basically we're going to use plan A, which I'm going to talk about on, zinc supplementation, and counseling for continued feeding, increased frequency and duration. You educate the mother on prevention, okay? So patients usually do not need admission if there are no other comorbidities. So if they have no dehydration, you do not need to admit the patient, okay, unless there are other comorbidities. Then you need to educate the mother or caregivers on the danger signs of dehydration, which are continuing diarrhea beyond 3 days, increased volume or frequency of stools, repeated vomiting, increased thirst, refusal to feed, fever or blood in stool, okay? And you also need to encourage the mother to continue breastfeeding longer and more frequently. So when we talk about plan A, you give ORS, which is 10 milligrams per kg per loose stool, okay? So if they're less than 2 years, you give 50 to 100 mils per loose stool, and if they're 2 to 5 years, you give 100 to 200 mils ORS per loose stool, okay? Then if they're older children, basically older than 5 years, you encourage them to take as much ORS as they want. And you also need to tell the mother to give frequent small sips from a cup. If the child vomits, wait for 10 minutes. Then continue, but more slowly, okay? And continue giving extra fluid until the diarrhea stops. So now we go to some dehydration, which is basically 5 to 10% of body weight loss. So there are 2 or more of the following signs. So they may present with 2 or more of the following signs, which include restlessness, irritability, sunken anterior fontanelle and eyes, tears are absent when crying, mouth and tongue are dry, there's eager drinking, they are thirsty, then skin pinch goes back slowly, it takes about 1 to 2 seconds. Then in this case, you need to weigh the patient and use treatment plan B. So earlier we talked about plan A, now we go to plan B. So management of patients that present with some dehydration. The three essential elements in the management of all children with diarrhea are rehydration therapy, which is Plan B, zinc supplementation, counseling for continued feeding, and prevention. Then all cases with obvious signs of dehydration need to be treated in health centers or hospitals. So Plan B basically involves giving 75 ml per kg in 4 hours of ORS, okay? And then if fluids can be tolerated. If fluids can be tolerated, you give what? 75 ml per kg in 4 hours ORS. And you reassess after 4 hours. If there is no dehydration, transition to Plan A. So basically you give 75 ml per kg in 4 hours of ORS, okay? Then after 4 hours, you reassess. Then if they appear to be better and there's no dehydration, then you move to Plan A, which is basically you give 10 ml per kg per loose stool, okay? Then you need to tell the mother to give frequent small sips from a cup if the child vomits. Wait 10 minutes, then continue but more slowly and continue giving extra fluid until the diarrhea stops, okay? Then if fluids are not tolerated orally, you give IV Ringer's lactate. Then you also need to administer zinc sulfate, okay? Here we go. So for zinc sulfate, if they're less than 6 months of age, you give half tablet, which is 10 milligrams per day for 10 to 14 days. And if they're above 6 months of age, you give 1 tablet, which is 20 milligrams per day for 10 to 14 days. Then if the infants, you dissolve the tablet in a small amount of clean water, expressed milk or ORS in a small cup or spoon. And if they're older children, they can chew the tablet or drink it dissolved in a small amount of clean water in a cup or spoon. Then you also need to administer antibiotics such as ciprofloxacin or cefotaxime. Then you need to add metronidazole if there's bloody diarrhea, okay? Then you need to deworm all the children with mebendazole if they have not been dewormed in the past 6 months. Now let's talk about severe dehydration. So this happens if there are 2 or more of the following signs, okay? So these include lethargy or unconsciousness, depressed or severely sunken anterior fontanelle and eyes. One child cries there are no tears, mouth and tongue are dry, unable to drink or drink poorly, skin pinch goes back very slowly, which is it takes more than 2 seconds. Then you need to weigh the patient and use treatment plan C urgently, okay? So under the management of severe dehydration, the 3 essential elements in the management of all children with diarrhea are rehydration therapy Plan C, zinc supplementation, and counseling for continued feeding and prevention. You need to start IV fluids immediately. If the child can drink, give ORS by mouth while the drip is being set, okay? So you need to administer 100 ml per kg of Ringer's lactate solution or half-strength jarrows. And if none of the above are available, you can also use normal saline. So for children that are less than 1 year, you give fluids over 6 hours, okay? So if they're less than 1 year, you give fluids over 6 hours, which is 100 ml per kg, you give it over 6 hours. So how do you give that? So you give the first 30 ml per kg, you give it in 1 hour. Then the last 70 ml per kg, you give it in 5 hours. Then for children that are above 1 year, so the age between 1 year to 5 years, okay? You give 100 ml per kg in 3 hours. So take note here, we give it over 6 hours, here we give it over 3 hours. So how do you administer that? You give 30 ml per kg in the first 30 minutes. Then the last 70 ml per kg, you give it in 2 hours, 30 minutes, okay? Then you reassess the child every 10 to 15 minutes. If hydration status is not improving, you give IV drip more rapidly. Also watch for overhydration, okay? Then if IV therapy is not available, then ORS by NGT, nasogastric tube, or orally at 20 ml per kg per hour for 6 hours is given. If abdomen becomes distended or if the child vomits repeatedly, then ORS should be given more slowly, okay? Then also give ORS about 5 ml per kg per hour as soon as the child can drink, usually after 3 to 4 hours in infants and 1 to 2 hours in children. Then you assess an infant after 6 hours and a child after 3 hours. Then you classify dehydration. So if there's some dehydration, then you move to Plan B. And if there's no dehydration, you move to Plan A. And if the child is still under severe dehydration, you continue. Zinc sulfate, then you also need to administer zinc sulfate. So if they're less than 6 months, you give half a tablet, which is 10 milligrams. per day for 10 to 14 days. And if they're above 6 months, you give one full tablet, which is 20 milligrams per day for 10 to 14 days. Then for infants, you dissolve the tablet in a small amount of clean water, expressed milk or ORS in a small cup or spoon. All the children, they can chew the tablet, okay? Then you also need to administer antibiotics, ciprofloxacin or cefotaxime, and add metronidazole if there's bloody diarrhea. And deworm all the children with mebendazole if they have not been dewormed in the past 6 months. So basically that's all about dehydration. Now let's just summarize our lecture. So when we talk about mild dehydration, so this is basically just a summary of dehydration. Okay, it's basically stuff we've already discussed. So under mild, moderate, severe, this is no dehydration, this is some dehydration, and this is severe dehydration. So weight loss in no dehydration is up to 5%. They appear active and alert. Capillary filling or capillary fill time is normal. Pulse will be normal. Respiration will be normal. Blood pressure will be normal. Mucous membranes will be moist. Tears will be present. Eyes will be normal. Pink skin will spring back. So skin tear will be normal. And fontanelle, anterior fontanelle will be normal. And urine flow will be normal. When we talk about moderate dehydration, which is some dehydration, weight loss will be 6 to 10%. They'll appear to be irritable, alert, and thirsty. Capillary refill time will be slightly delayed. Pulse will be fast and low volume. Respiration will be fast. Blood pressure will be normal, although maybe orthostatic hypertension. Then mucous membranes will be dry. Tears will be less than expected. Eyes will be normal. Pink skin temps briefly. Fontanelle will be sunken slightly. And urine flow will be reduced. Severe, more than 10% weight loss. Then appearance will be lethargic, they'll look sick. Capillary fill time will be delayed. Pulse will be very fast and steady. Respiration will be fast and deep. Blood pressure will be very low. Mucous membranes will be parched. Tears will be absent. Eyes will be sunken. Pink skin will be prolonged. Fontanelle will be sunken significantly, and urine flow will be severely reduced. So basically, this is just how to identify treatments. We've already talked about the signs. If there's no dehydration, you administer fluids, zinc supplements, and food to treat diarrhea at home, which is plan A. Then you advise mother when to return immediately and follow up in 5 days if not improving. Then under some dehydration, you give fluids, zinc supplements, and food for some dehydration. You follow plan B. If child also has a severe classification, you refer urgently to hospital with mother giving frequent sips of ORS on the way, and you advise the mother to continue breastfeeding. You also need to advise mother when to return immediately, follow up in 5 days if not improving. And if they confirmed asymptomatic HIV, follow up in 2 days if not improving. Then severe dehydration. If child has no other severe classification, give fluid for severe dehydration, plan C. Or if child also has another severe classification, refer urgently to hospital with mother giving frequent sips of ORS on the way. Advise the mother to continue breastfeeding, and if child is 2 years or older and there's cholera in your area, you give antibiotics for cholera. So that's all about dehydration. Thank you.